Okay, we'll get started today, and we will be recording this class. The bad thing is that this is not a like a professional video. It's just a class recording. So we will stick together on it, and we will go to the course. So Robert's not here. Gulam, I assume, will be here, and Juliana, you're here. So you got 100% attendance today. That puts you in very good shape. Um, we have for this class. I have your notes, and let me see if I can pull those notes up. I just had them. Oh, there they are. So we can talk about the course itself. What I thought with this is that if I would do course notes, it would help us stay on topic and help you. And Juliana, like you said, feel free to write anything down. I'm not trying to keep you from doing that. I'm the same way. Sometimes I have to write things, so I when I write it ingrains more than when I just watch it. So we started last time, and let me take you out. I see that you have done your discussion, and I graded it a few minutes ago, so you got full credit for that. The topic that we'll be working on a couple of weeks is this foundation of health rights. And we have, and when you go into that, you see that there are several subtopics, and I want to spend a little time with those. The first one is health as a human right, and then the historic evolution or development of health rights. We'll talk a little bit about that today because there's some overlap in that. And then the third topic will be international declaration and agreements, the role of global cooperation. I don't know if you noticed in the news that President Trump withdrew the United States from the World Health Organization. And some of the it's really interesting because California, the state, now has joined the World Health Organization. So there's a lot of politics going on right now. But a lot of that originated with the response to COVID, because when COVID hit, it became a very hot political topic, and there's still a lot of both parties still have a lot of ill will about COVID and the number of dead and all sorts of things. I personally don't see how anybody could have anticipated what happened with COVID. Oh, I was just blown away. I was over in the United Arab Emirates, and we were watching videos of Italy, and so many people died in Italy with COVID so quickly that they couldn't bury them all. And they took refrigerated trucks and filled them with the bodies of those who had died. The first wave of COVID was very, very, very deadly. So that's part of what's going on. President Trump feels that helped get him voted out of office the first time. Uh, who knows what the Democrats feel, but the fact is that health care is important. And when we look, let me take us to these notes, because I want to talk about this as subtopic one, health as a human right and definitions and principles. The argument as to whether health care is a human right or a privilege is a ongoing argument. Um, what happens when someone cannot access medical care, not because of it doesn't exist, but because of cost discrimination or lack of facilities? What would I do if I went to the hospital and they said, "You're Anglo, you can't come in," and I'm dying? I sat on a jury one time where an electrician's wife had been hit in an accident, and she was bleeding badly, and they had her in the hallway, and he was afraid she was bleeding to death. So he went in and told him, said, "You treat my wife right now, or I'm going to cut one electric line to this hospital, and it'll take you 6 weeks to get service reestablished." He said, "I'm the one that wired this." hospital. And they treated his wife and they prosecuted him. And fortunately for him, myself and one other person were on the jury. The rest of them wanted to convict him, but the two of us refused because we felt that he was under duress, emotional duress with his wife, and he was trying to intervene for her care. Well, what would I do if my wife went to a hospital and they said, no, she's over 65, we can't treat her? Or if they said she's an East Texan, so we're not going to treat her. Is health care a human right or is it a privilege? And that's a tremendous argument, and one I don't think that we can necessarily answer in this course, but we can see some of the effects of the question itself. When they define health as a human right, the World Health Organization defines health as a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. We might tend to think that health is being well. Come on in and join us, Gillen. We might tend to think that health is being well, but they're talking about different aspects of health. They're talking about physical health, mental health, social well-being, all of those things bringing health to the issue. Let's talk just a second about World War II and the effects of World War II. I knew, we're in 2026, so we're a long ways from World War II. We're what, 70, 80 years away from World War II. I knew some of the men that fought in World War II and some of the women that did. I knew a woman who served in the combat arena against Japan. And she was telling one day she walked out. She was the old lady then, but she told me, said, oh, I walked out, and she said, I was going to have a cigarette. And she said, we were in New Guinea, and I looked up, and there was one of those wild tribesmen looking at me. She said, he just waved and went away. But that generation in World War II experienced devastating uh, devastation of society. Millions died in World War II. And because there was a lack of health care, because, the world was at war, they were exterminating populations. There, just to describe it is just unbelievable. I knew another man that was Japanese American, and they put his family in a concentration camp and sent him to fight for the United States. I see a contradiction in that. If he is good enough to fight for the country, his family shouldn't have been in a concentration camp. But World War II brought about a lot of deliberation on the ills of society when it ended. Germany was absolutely destroyed. Much of Europe was devastated. The Middle East had been torn apart. North Africa was devastated. Asia, the war against Japan was just unbelievable. But what happened is during that time, as they rebuilt, that generation that rebuilt the world, they began to talk about things like health care. They began to talk about the United Nations. That's when the United Nations was born. They talked about world peace. Nobody wanted to go back into a war like that again. So whether the World Health Organization was directly born out of that or not could be debated, but it was a driving factor in organizing the World Health Organization. We saw in the COVID pandemic the importance of having a World Health Organization, even though everybody was pointing fingers at everybody else. At least the discussion was going on. I don't know if you had any COVID shots, but I had 3 of the Chinese shots. They gave me the first one and mandated that I take it because I lived in the United Arab Emirates. You didn't have a choice. You either took the shot or left the country. And I took the shot. And then they said, well, you're taking Plavix because of your heart. I said, yes. They said, well, you can't take any more because they had a person die but with a reaction to Plavix. The doctor said, stepped in and said, his likelihood of dying from that is less than his likelihood of dying from COVID. If he gets it, he's going to take the shots anyway. So they had to start me again, and I took the double series. But those were Chinese shots, not United States shots. You know, later the Chinese were the first to develop the vaccine. And in that part of the world, it was distributed. But look at how nations acted when it came to the COVID shots. Those nations that had money, they looked out for themselves, didn't they? What about the poor countries? And just like there are rich people and poor people, and I'm probably down towards the bottom. Um, I laugh. I remember my grandfather being alive one day, and he was a devout Democrat. And I told him, I said, he said, "How are you going to vote?" I said, "Well, I'm thinking about voting," and I was going to vote, I think, for the first George Bush. And my grandfather said, "Oh," he said, "the Republicans are for the rich." And I answered, said, "Well, the Democrats are for the poor." And he said, "Son, you better look which you're closer to." I'll never forget that. I laugh about it. But the wealthy nations looked after themselves, didn't they? What did the poor nations get to do? They got handout if they got that. They weren't really worried about the rich nations, whether the poor nations were taken care of. And that is contradictory to the spirit of nations that came out of World War II. The world had been so devastated in World War II that there was this overall desire that all people are people. And the only way we can survive as humanity is to care about each other. I laughed when I went to the Middle East. One of my friends said, "How did you stand in the United States?" I said, "What do you mean?" He said, "Well, they were all dancing around the barrels with fire in it and hating each other." I said, "Where did you see that?" I said, "Maybe you saw that on the same place that I saw all the Arabs carrying guns shooting in the air." I have all sorts of friends. I have a Hindi friend, uh, Jody. She's Sharon's dear friend, and I have a friend that is close to me. He's like a son. He's a Muslim, and you turn around and you look at the end of World War II. There was this desire that we see humanity as humanity, and yet since then we see it gravitating somewhat the other way. That when we saw COVID, the rich nations took care of the rich nations, took care of themselves, and left the poor nations to fend for themselves. The World Health Organization was organized to help nations cooperate. And whether the United States is part of it or not, I mean, I'm not the politician that decides that. I would prefer that we were personally, but there's a lot of politics that got into that. California now, the state of California belongs to the World Health Organization, and the United States is withdrawn. I don't know. Maybe I doubt Texas would join because California is a blue state and Texas is a red state and all this type of stuff. But it is important that we view humanity as belonging to God. The Bible teaches us that God created man in his own image, and it didn't say one or another. People are people. And I enjoyed living in the Middle East because I had a lot of international friends, and I of course, came to understand from that what I already knew, that people are people and that all people's lives are important. Whether you live in a rich country or you live in a poor country, people matter. Now, the World Health Organization's statement about physical health, mental health, and social well being, defining part of what health is. We think about physical health because, we get sick and we want to be healthy. We get old and our body begins to run down. I have in my heart, you could see in here, I got 7 stents where I've had blockages. They told me, said, "Oh, your heart is excellent. It's your arteries and veins." problem. I said, well, you can't operate a heart without arteries and veins. But then that they mentioned mental health, mental well-being. The importance not just of being physically healthy, but mentally healthy, and then social well-being. They included that as part of health. When I grew up in 1960 Georgia. I was born in 1956. I remember the 60s. I happened to really enjoy listening to Martin Luther King's speeches because he was marching for civil rights and demanding that black people and Jewish people and others and Catholics and others be treated just like white Anglo-Saxon Protestants. And I deeply appreciate that. But what about social discrimination? What about societal ill? You know, when 911 happened, I have a very good friend. She's a friend of Sharon and I. She's a math teacher. She was from Iran and a refugee to the United States. She was afraid to go out because she was afraid that somebody might kill her out of hatred, out of racial anger. And you turn around and you look at a lot of what's still going on, in not just in the United States, but in the world. Health is not just physical and not just emotional, but there's societal health. Society should value people. We the key implications, of course, in the World Health Organization statement is physical, mental, and social health. But health is influenced by a lot of things. Health is influenced by housing, whether or not you have availability to housing. Health is influenced by education. Do you know that the more educated you are, the longer your lifespan is? That's a rule. Uh, I was watching a comedian the other night, and he said, "What is the average?" He's an old man. He said, "What is the average age of men in the United States?" He said, 74. He said, "What is the average age, lifespan of women?" He said 81. He says, "I'm going to make the transition." I just rolled. I thought that was so funny. You know, he's talking about turning into a woman so he'd live longer. But you look at education. Education has an impact on your lifespan. The more educated you are, the more likely it is that you will earn a healthy income. And it's not the education that increases your life necessarily, but it's the revenue. Money helps. If you have money, you can purchase health care. If you don't have money, you don't get health care. Why do you suppose women outlive men on average in the United States by 7 years? Juliana, are you to blame for that? Well, women's lifespans long. You know who holds the wealth in the United States? Old women. Because they get married, the husband and woman earn the money and the man dies. I had a friend. He was always going to go on a cruise and meet a rich woman. You know? I laughed. I laughed. He finally went on a cruise and met a woman and married her, but she wasn't rich. You know, he just liked her. But anyway, education does make a difference in your health well-being. I think education has a hand in your emotional well-being, your mental health. We learn in education about how to talk to ourselves. You know, if you get up every morning and you look in the mirror and say you're a worthless loser, and you're saying that to yourself, you've begun to feel like a worthless a loser. But if you talk to yourself and you talk about, yeah, I can get this, I got this, I'm going to get through it. I call my sister regularly, say, hey, you got it, Karen, you're going to do it. Everything's going to be good. Then you know your outlook affects your mental health, and your finances have a big play on your social health too. I hate to say it, but I think it's obvious. The United States, the major form of discrimination now is financial. If you're rich, you got it made. If you're poor, you know, whatever. The Bible talks about the church saying to a rich man, "Come here and have a seat," and telling a poor man, "Just stand over there." They said that's not the spirit of God. God loves all people equally. But education and nutrition, how you eat, different generations eat differently. There are ways to eat and end your life. My wife gets on me because I have cholesterol buildup. That's why I have those 7 stents. And I like ice cream. Man, I would kill right now for a bowl of vanilla bluebell ice cream with chocolate syrup on. Go for it, you know. But that's why that style of eating and not eating healthy is led to some of the cholesterol problem. Now,
Usually, like healthier foods and organic foods are more expensive too.
oh yes, and that's economic too. Well, I remember when eating organic was what the poor folks did. I remember nowadays tennis shoes are more expensive than shoes. I remember when shoes you only wore tennis shoes because you couldn't afford shoes. Okay, but the world's changed and it's very much a economic situation, and how we eat is a lot determined by the wealth that we have. My wife bought, I think, 5 pounds of hamburger the other day in a 5 pound package, and it was like $50 or something like that. I told her, I said, Sharon, we had a deal years ago. I pay the rent, I do this, she buys the groceries. You know, we've always worked. She's beginning to second guess some of that because groceries have got expensive. She tells me, you know, Zoe. I don't know if you watched my little autistic son, but Zoe is not a cheap date. Zoe is an expensive date. You take him into Circle K and he loves Circle K. He wants a Coke. Well, you can get the fountain drink for 99 cents. He wants 2 bags of potato chips, not one, because he knows they sell them two for 4.50. He wants a bag of Jack Link's beef jerky, which is $6, $7. You know. Then he wants these gummy things, and they're sour and all. I mean, by the time he gets through, you know, you got $40 worth of junk that he's bought. He's got him a sack full going to the car to the next trip that he makes. So, you know, he likes that, but that's not good for him. And Sharon and I have been talking about that. That for him, he needs to eat homemade food. And what you're talking about, eating organic, we call homemade. You know, that's what my grandma made. My grandma raised peas out in the garden and she picked those peas and she made those peas and she made squash and I love that type food. It's just that we live in a fast food society. Sharon comes home from work and I say, oh, Sharon, you're tired. We'll just go get a burger.
Yeah.
And where you go get that burger is a big difference, you know.
But what is the problem? The problem is the time.
Yes,
If you don't,
we don't have time. My grandmother, I remember going to see her, and she'd decide we were going to have chicken for lunch. She would have killed a chicken, and pick that chicken, and that chicken was not fed all these things that they feed them now to make them get big real quick.
Oh,
Oh, yeah, it was a regular, you know, I've often wondered, is that why we grow hair on my ear, you know, because all these hormone things they have with stuff. I laughed, I told Sharon one day, I said, I got more hair on my ear than I do on my head anymore, you know. Look like Yoda from Star Wars is what I was kidding her. But housing and education affect your nutrition and the safety, you know. There are places that you can live that are dangerous. And if you're poor, do you have a choice in where you live? And then social inclusion. I remember when schools were segregated. If you weren't white, you wasn't going there. For when they began, and if you were Hispanic, you weren't going there either. By the way, you know why Baptist University exists? It was organized in a time where they wanted to segregate Bible education. Whites could go to Southwestern. The Hispanics could go to BUA. You know, back then it was the Hispanic Bible School or something like that. Yeah, but it's not the only institution. And one of my friends was president of Southern Bible Institute for many years, a black institution. And they were organized because the whites didn't want the blacks to go to school with them. Well, society has begun to change a lot of that. But we still have discrimination today. I stopped at a store the other day, Circle K. ICE was there. I'm talking about these guys had vests on, pistols. I mean, they were rough looking guys, and I wouldn't get in a fight with one of them. He looked me over. He didn't say anything. What if I had been Hispanic? Do you think he might have checked me out? Yeah, but I was white. Okay, yeah, well, I got green eyes, got the Waller crazy green eyes. If I put on blue clothes, they look blue, but they're the Waller crazy eyes. My sister laughed, said, "You got those Waller crazy eyes," because all of the people that had that color eyes in my family were crazy. And I told her, I said, "No, mine are a little bit." She's got brown eyes. But they kid about that. But what about in social inclusion? Is there social exclusion in our society? You go to the emergency room. Now let me tell you, you walk in the emergency room, there's still a difference in whether you white old guy or young Hispanic guy. Who they're gonna treat first? They're gonna treat me first because they assume I have insurance. And let me tell you that racism is still very much at work in our society. And I get in trouble for telling you that. But health extends beyond just hospitals and medicine into the full living environment of people, our full environment. Oh, and that brings up a lot of questions because what if we assume that health is totally a human right? Then we're entitled to housing, we're entitled to education, we're entitled to nutrition, we're entitled to safety, and we're entitled to social inclusion. But we are somewhat, aren't we? But does that mean the government's going to buy a house for us? Well, it does for some people. Oh, you get old and you don't have any money, you can go down and they'll help you. I've helped people get into public housing. Education. Education is a mixed bag because they say that public education is a right, but higher education is a privilege. So you go to school here and it costs you nothing, supposedly. You get your kids into cheerleading or basketball and see what it costs. I mean, it costs a bunch. My daughter has her two into cheerleading, and she's always fussing about how much it costs. Well, I said, "You pay taxes, don't you?" She said, "Yeah, but they don't count that." You're going, but if public education is a right, then it ought not to be discriminatory as to who can be a cheerleader based on how much money you have. I used to teach public school, and in my mind, everybody that went out to be a cheerleader ought to got to be one. If everybody went out to play football, let them play, have some fun. It's not about who can be the state champion, but it ought to be about growing up athletes that learn leadership. But guys, I'm kind of radical, okay? But if it is a right, then we're entitled to it. And if it is a privilege, then we have to pay for it. And all of these things that I've mentioned fall in between, don't they? Sometimes part of it's seen as a right, but the rest of it's seen as a privilege. Health care in the United States is treated as a basic privilege for most people. Now, when you get old, it becomes right because you paid Social Security and Medicare all your life. Now, hey, I'm under Medicare now. I got my little Medicare card. Oh, let's see if I can find that sucker. I mean, I can get my little Medicare card and I can go down. It's my little Humana card. This is the coolest thing. There's Zoe's Molina. Here it is, right here. That's his card for his Social Security, which he can go, which will be here on the 30th. He'll be spending it. I'm telling you, Zoe goes through money like a vacuum cleaner through dirt. But you look at these cards. I'm gonna show you this card right here is one of my Medicare cards. And this is my Humana because my spending account card, they put $75 a month on that card for me to go get stuff. Part of my Medicare. But I paid Medicare all my life. And now I'm old and I'm drawing it. But guess what? If I get close to death, they ain't going to spend a big fortune to try to save me. They're going to come wish me the best. Okay. We hope you're prepared to cross over, my brother. But anyway, that's seen more nowadays as a right for the old. But who needs health care coverage the most? Old people or young people? Well, it depends. What if I'm a young father, and I remember being a young father, and I had three children before we got Zoe, and they were all little kids, and I couldn't afford insurance. What I worked for didn't provide it, and I couldn't afford it. My son got hurt in a bicycle accident and had to have surgery. I had to pay for it. I paid out over time, made payments on it. We got it paid for. But is it a right or is it a privilege is the question. And I don't think anybody answers that. The World Health Organization views certain parts of healthcare as a right worldwide. The American Declaration of Independence says we hold these truths to be self-evident, that all men are created are endowed by their Creator with certain inalienable rights, that among these are life, liberty, and the pursuit of happiness. You see, they were saying we have a right to live, and we have a right to be happy, and we have a right to be free. But when they wrote that, it's really odd that they wrote that. But many of them owned slaves. I mean, so it was kind of contradictory, and it's remained contradictory since then. It wasn't clear. Health and international human rights law, the Universal Declaration of Human Rights in 1948. When did World War II end? Any guess? 45, 1945. You nailed it, Juliana. The World War II ended in 1945. When are they making this declaration? 3 years after World War II ended. And World War II had such a devastating, uh, devastating cost to humanity. I mean, people were exterminated just because of who they were and their nationalities. Um, So, in the Universal Declaration of Human Rights, 1948, recognizes the right to an adequate standard of living for health and well being, including medical care and social services. Now, this was done in 1948. We're 1926. 2 years, we'll be 80 years. So, we're 78 years from this. They said this 78 years ago. And where are we today? Now there's varying views, but you see it historically developing. I what if my grandchild was sick and had cancer and didn't have insurance? I would expect them to be treated. Do you know that there's a blend of the mindset that it's a right and not a right? Because if you go to a county hospital by law and you have no insurance, they're required to stabilize you by law. If they send you home and you die, the family's going to get some money from them before it's all over with. Okay, but you go into a hospital now and they check you out. They talk to you. I went in last little heart issue I had. They asked me, said, "How old are you?" I said, "I'm 68." Then I was 68. They said, "So you have Medicare?" I said, "Yes, and I have Blue Cross and Blue Shield through work." Man, I needed to be hospitalized right then. What if I had been 64 and I'd had no insurance? And what if I had been black instead of white? You wonder, don't you? You wonder. They triage you to determine if you really need care, if they can send you home or not, and they have standards. If you're having heart pains, they might do something and send you home. They treated you, they just didn't take care of the problem. So the International Covenant on Economic, Social, and Cultural Rights established the right to the highest attainable standard of physical and mental health. The key word is attainable. You can't afford it, It's not available. Well, it's not attainable, is it? But let's go back to that life, liberty, and pursuit of happiness statement. In that, there is some vision of people are entitled to live. People are entitled to be happy. Uh, I know some of the guys that wrote that were slave owners, some of them weren't. Now, the one who actually wrote it, Jefferson, not only was a slave owner, but he was having children with one of his female slaves. She was the sister of half sister of his wife. Pretty interesting, you know. And they proved that. That was a rumor when he was alive. They used it when they were running against him. He denied it, but they've proven it with DNA since then. Governments are not required to give us to guarantee that we're always in good health. Governments are required to create conditions that allow people to achieve the best possible health within available resources. Big difference between those two statements. Guarantee that we're good health and give us access within available resources. Big difference in those two things. The core principles of the health AAQ. AAQ is an acronym. I have it down at the end of this paper. Let's see if I never can remember anything except I can remember fishing tools, availability, accessibility, acceptance, and quality. So that's what AAQ framework stands for. Availability. They need to exist in sufficient quantity. And I think there has been a lot of movement towards that. When when I was a kid, there were places that didn't have doctors available. Hospitals weren't there. I got sick when I was about 6 years old. I got pneumonia. And back in those days, when kids got sick, you might die. I mean, you die of pneumonia. I mean, you go. My grandfather had penicillin that he gave the cows, and he had that big shot needle they gave the cow. He got that big shot needle and he gave me a shot of penicillin. I was well that afternoon, and if I wasn't well, I wasn't going to tell him. That shot needle hurt like all get out. But my family didn't have money to take me to a hospital. Hospital was 80 miles away from where we lived. Daddy had been discharged from the military because he had ulcers, and they gave him a medical discharge and didn't give him any revenue, and they were just barely surviving. But availability of health care means that we have hospitals and clinics, trained healthcare workers. The state is interested in how many trained doctors and how many trained nurses there are. Years ago, I would work with the state of Texas. I chaired a lot of visits of health of higher ed that wanted to come into Texas, and Galen School of Nursing wanted to set up in Texas. Come on through, you take care of yourself, brother.
Thank you.
You have to hop the cord there. Hop it again. But the Galen School of Nurses wanted to come into Texas. And the traditional thing was they set up and then you visit here in Texas. The governor wanted Galen to come in. So we got a call that told us, said, "You're chairing the committee." I said, "Yes, I am." He said, "You're going to Illinois to visit Galen School of Nursing, and you're going to take what they do there as what they will do here." So they made an exception. Why did they want Galen School of Nursing? Well, they wanted nurses. There's really not a shortage of nurses. Nursing is such a hard profession. There is a shortage of skilled people who will work as nurses. It's a high stress, demanding job. I wouldn't want to work as a nurse. It's a hard job, a lot harder than what I do. But the government has a responsibility to see that there are trained medical professionals, EMTs, paramedics, nurses, doctors. The government is interested in how many of those there are. Oh, in the Midwest, and like Alaska and other places, there are places where they don't have doctors. So what they do is they go to a medical school, and the government says to them, if you will go practice in whatever Alaska, then what we will do is we will pay. If you'll work 5 years, we'll pay off we'll release you from all your student loan. You know how much it costs in a student loan to go through and get to be a doctor? Probably $500 million plus.
And then you moved to Alaska.
Yeah, and then, but you have to. I would love living in Alaska. Do you know how good the hunting is in Alaska? Man, I wipe out the caribou herds. I mean, I like deer meat. Anyway, I'm laughing, but you have to live there. What about availability of medicine? The government is responsible to see that medicines are available. What happened with COVID? Even the White House got involved in driving the approval of the vaccines through. People were dying of COVID left and right, and they were saying, "Oh well, it'll take 3 years to get an approved vaccine." No, it didn't. When the government got involved, we need it now, and they knew that people were going to die from the vaccine. They knew that, but they knew that more people would survive who would have died than died from the vaccine. I know a man that died from the vaccine. They gave it to him. He was taking Plavix for his heart, and the Plavix interacted with the vaccine. It caused blood clots, and a blood clot hit his heart, and he died. That's why they only let me have one of those shots. And then the doctor had to step in and said, well, he may die of blood clots, but it's better than die. He's more likely to die of COVID. And they gave me the shots, and I had a blood clot. I don't know how a blood clot hurts as bad as it does, but I had one in my leg, Lord of mercy. Women tolerate pain. That's a sexist remark, isn't it? But I curl up in a fetal position when they cut my toenails. I mean, I'm terrified of that stuff. But all of the availability is part of what's required. It must be available and accessible. Healthcare can be available but not accessible. Accessible means that the people have access to it. What if we went and they said, because my wife has a Hispanic great grandmother, I believe. What if they told her because she was part Hispanic she couldn't have access to it? Now believe me, they did that at one time. I had a good friend that pastored a church I went to. Very fine man. He went out to West Texas in view of a call by himself, and they called him as pastor. Then they found out that his wife was Hispanic, and they fired him. And his wife was the wonderful lady, great woman, and absolutely a beautiful woman, but they fired him in their discrimination. Accessible means that there's no discrimination. It's physically available. What if you're in a wheelchair and you can't, it's all up these steps, you can't get in? It's economically accessible. There's a way for the poor to have access, and information accessible, right to receive information. What if you just went to the doctor and they wouldn't tell you anything? That'd scare me to death. I mean, they can suggest to me you might have a cough. Next thing I got a cough. They can say your hand might be hurting. Next thing my hand's hurting. So if they don't tell me stuff, scare me to death. So we're talking about available, accessible, and acceptable. Uh, they must respect medical ethics. There are tremendous medical ethics. Culturally appropriate. Do different cultures expect different things from healthcare? Now, sometimes, well, we want a good life and all of that, but there, I was thinking about when we lived, my wife lived, we lived in the Arabic world. She had a female doctor, okay, because there were a lot of laws about like when I taught school. Here might go up and say, "How are you doing?" You don't do that over there because that's culturally unacceptable. Um, must be culturally appropriate, maintain dignity. You know, as you get older, you're treated differently in healthcare than when you're younger. They tend to. I laugh. I go with my wife, and my wife is 3 years younger than me, but she looks 10 years younger than me. I told her, I said, it's because I've been just worked to death, and she's had a good life. I kid her about that. But that when I go in, they will talk to her rather than to me, because I'm 69. The older you get, the worse it gets. So one of my friends is in his 80s, and he told me, he said, "Oh, you ought to go to the doctor when you're 80." They don't think I know enough to answer. I said, "Yeah, but I tend to straighten them out if they make me mad." But maintain dignity and sensitivity. Oh, align with scientific standards, and that's an acceptable healthcare. It has to honor human values and professional standards. We have HIPAA, which is the Right to Privacy Act. Somebody calls up just because I'm old, we want to know what's going on with. They can't tell them without my permission. Now, on my file says if anybody from my family, my wife, my daughter, particularly, because my daughter, she called and asked, they don't tell her my butt's dead. Okay, she'll kill you, and then laugh about it later. My daughter's a health professional, but those things are important, and they have to operate within the boundaries of the law. There are people whose faith does not believe in blood transfusions. When you go in the hospital, well, what if they serve you for food? Muhammad is my kind of like my son, but Muhammad isn't going to eat any bacon. It's against his religious faith to eat that food. And and other thing is, they eat that hog lard and they've got cholesterol problems. Lord of mercy, it's not good. But the quality of care is important. It has to be sound, delivered by professionals. And healthcare professionals are professionals. And I treat my healthcare professionals with respect, unless they disrespect me. I had one doctor one time, yes, yeah, like that to me. I said, wait a minute. I said, are you proud of your medical degree? Well, yes. I said, you like people calling you doctor? Yes. I said, well, I'm not Mr. Waller. I'm not even Dr. Waller. I'm Professor Waller. I earn full, and I'm a distinguished professor. I earn the full title. I said, you don't refer to me disrespectfully anymore, because he was being disrespectful. And my wife said, I can't believe you did. I said, well, he won't have another chance to treat me because he was disrespectful to me. But we expect them to be professionals, to prescribe safe medications. There's some medicines that will kill you. And they have bad side effects. And not just that, you can take this medicine and this medicine, but when you take them together, they combine to create all sorts of problems. So we expect where we go to know the side effects of the medications that they're giving us. Oh, my last time I went or saw I went to the healthcare, my nurse practitioner, time back before that's who I generally see, because I like Eduardo. He's a veteran, and he's a fellow fisherman, and we can talk a little fishing and different things like that. But he told me, he said, you're not taking enough of this one medication. He said, I'm gonna double it. I thought, oh God. He's going to double it, because those pills are big old pills. And instead of swallowing two, I have to take two at night and two in the morning. And I don't swallow things easy. Lord of mercy. I'm gagging, trying. But when I went back, my cholesterol count had been like 8.1, then it was 6.8, and they're trying to get it down to 6.3. So it helped me. But if he had doubled that medicine and it contradicted with something else, he's always saying we're going to do this, but he said, let me check to see if there's any combined effects of the medication. And he does that. We expect that. That's part of good quality health care. What is the state obligations under a human rights framework? Well, we're entitled to respect, we're entitled to protection, prevent third parties from violating our health rights. What if the insurance company could get into my medical records and they could do a DNA test on me and decide that I had a propensity towards heart disease and refuse to cover me? And that's, listen, recently, until just recently, that's where they were headed. They call that a pre-existing condition. And then the American Affordable Care Act stopped a lot of that. And now the American Affordable Care Act is, a lot of its provisions are being discontinued. So insurance is skyrocketing in cost, and the president is afraid now. He's trying to drive it back down because he knows that Americans, when prices go up, we remember that and we vote against people that do that. But respect, protection, to fulfill, they need to have policies and funding and laws and infrastructure to support health care. Oh, they were talking recently that nurses are not considered professional employees. Who are they fooling? A nursing job is a hard job. I used to be a dean over health care. We had an RN program, we had an LVN program, we had an occupational therapy assistant, a health information technology, and a paramedic program. Now tell me that a nurse is not a professional employee. The nursing program is a hard program. There are many that try to go in, but it's hard to get through, and they should be treated as professionals. So I don't want the insurance companies and the big companies making all the decisions. I want laws to protect us as human beings. We've seen in the country where a corporation poisoned the water supply and created all sorts of cancer as a result of the poisoned water supply. And the government finally, the courts had to step in and straighten it out. But you know, if your child died of cancer, I don't care how much money you get. It doesn't replace a child. And that's a problem. We have a shared responsibility between us, the government, and the healthcare providers. We need to, international cooperation is important. The community has to participate, and we have the individual. I have responsibility. I can't just expect the doctor to keep me healthy and I do whatever I want to do. And I have an individual responsibility when I go to the doctor to discuss with them what they want to do. And if I agree to it, to do it. I don't like taking medicine, but I have to. The framework that we're talking about is an efficient system, but efficiency in healthcare is as we talked about last semester, Juliana. Efficiency is defined differently by the patient and by the insurance company. The insurance company says it didn't cost much. That's efficient. The hospital's efficiency, or what are my survival rates? And the patient is efficient as if it works. I mean, they can see me. I've been trying to get Zoe a new healthcare provider, and I called United University Healthcare, and they said, "Where are you?" I said, "Well, I'm about 15 minutes." "Well, you can be here by 4." I said, "Yeah." They said, "Come on, bring him now. We got it opening." I left. I got there at 4 o'clock. Walked in with him, and Zoe was so happy because he thought they were going to see me. Any shot Daddy was going to get. He don't have a problem with Daddy getting the shot or anything. But all of a sudden, he figured out it was him. And man, he was watching them close. He was bent out of shape. But is efficient to me means we can get in. Not going to take me 6 months to 2 years to see a heart doctor. If I'm having heart pains, I need to see a doctor at a hospital now before I have a heart attack. And I've had chest pains before and had to go to the hospital then. And I needed to see somebody. That's efficient to me. To the insurance company, it might be efficient. Well, let's hold on. Let's wait 6 months and see if it really is. And to the medical center it is, well, we want to make sure he survives. We don't want to send him home to die and then we get sued. Some of the other questions we can ask, is it fair? Who is excluded? Are inequities being addressed? You know, health care should be for all people. And that's the World Health Organization. That's what they're saying. Rich country, poor country, it doesn't matter. Health care is something that human beings require, and the health care should be physical and mental and social. These perspectives emphasize social determinants of health, accountability. Some of the key takeaways that we want are dignity. I want to be treated with dignity. You ever had to put on one of those hospital gowns? There ain't much dignity. They were rolling me back this last. I was over in the United Arab Emirates. They did a heart stent on me, like the sixth, fifth, and sixth ones, and there you're awake. Here, I want to be. I don't want to know. I want to wake up and it be done. And if you kill me, then I just don't wake up. Okay?
You were awake.
I was awake. I felt him rotor rooting around in my heart.
You didn't feel like any pain?
Oh yeah, I told him. I said I'm having a heart attack because he was trying to go through a blocked area and he managed to open it up. He told me, he said, just be calm. We're going to get it open. You're going to be okay. But when he was there, it blocked the blood flow. And what happens in the muscles in your heart, when the blood flow stops, you don't have oxygen. That's what the pain is. Not the blood stoppage, it's not the lack of oxygen. And it opened up. I told Sharon, don't ever, ever, ever do I want to be awake again, you know. But he was rotor rooting. I could feel him rotor rooting around in my heart.
Did they give you an option to stay awake? Or?
No, that's just what he did. He said, I need you awake. I need to know what's going on. I thought I don't. but what I'm coming to is I had that little gown on, you know. Man, that is so embarrassing. But anyway, one of the nurses, God bless her, may the Lord cause his face to shine upon her. She said, are you cold? I said, yeah, I'm cold. She put a sheet over me. And as long as she didn't pull it over my head, I was okay. You know, that's what they do when you die. But anyway, but you know, what is your dignity? We need to be treated with respect. All human beings should be treated with respect. And my mother died back last September. My mother was having severe dementia. But even then, she needed to be treated with respect. Uh, they mother was dying, and they started giving her morphine. And when you get to the end of your life, they won't practice euthanasia, which is the killing of the elderly, but they sure give you a lot of morphine. And morphine is deadly. And that's what they're doing. They're we're easing her pain. Yeah, she slipped on, but what quality of life did she have? She didn't have much. But I didn't want mother laying there and being thirsty, wanting water to drink or something to eat, being hungry. She didn't know anything. But we made them take water and touch her lips because I wouldn't want to lay there and be thirsty and be dying. But equity, opportunity, ethical responsibility. Health reflects societal values and commitment to justice and peace. Justice is a strong word with healthcare. To treat people the same, give them opportunity. Now, listen, I understand if you need a heart transplant and you're poor, you're not going to get it. Listen, at my age, if I need a heart transplant, I'm Social Security and I've got insurance here, but that insurance isn't going to approve a heart transplant on a 69-year-old, most likely.
Professor, here we have a list,
Mhm.
and then we put the person in the list, but it depends of what we have.
On the genetics of what's compatible, because you can't just give any organ to any person.
No.
You have to have a match. But if you're wealthy in the United States, you sure move up the list quicker, don't you? That's not right, but that's what they do. But that's the reality of
And
it.
it's paid for the government,
Yeah.
it's not private.
And
versus-
there it's paid by the government. Here we have private insurance.
And that's in Brazil, the government pays for like heart transplant.
Mhm. They do, we have.
Yeah, and in the United Arab Emirates, they do. You know, the United States is very bad about looking at other countries and, oh, well, the healthcare in a lot of other countries is better than it is here. We have the best healthcare in the world if you're wealthy. If you're not wealthy, what are you going to do?
And if you have money.
Yeah, you have money. Now, there are other avenues that you have to go through that you may be able to get help and you may not. They take somebody my age. I'm 69 years old. Oh, if I need a heart transplant, the likelihood of me getting a heart transplant's not good. Now, if I was 29 years old, there's a better chance that they would do that. But my age, my mother-in-law needs a hip replacement. She's 88 years old, and on the first stages of dementia, they're not going to give her a hip replacement because they look at the cost and the gain that you might have, and how long is it going to extend your life? I had a good friend. He was very wealthy. He owned a car dealership or two. You know, he wasn't no poor man, but he had a heart attack, and they put one of those pig valves into him. But they don't tell you that that thing only works so many years. And once they've done it, it can't be replaced. I'll never forget. Right after he had his surgery, I saw him we went in to eat. I said, "Urban, how are you doing?" Because he'd had this pig valve put in his. He said, "I'm doing pretty well," but he said, "I have the strangest urge to eat corn on the cob." He had a real sense of humor about it. But they would not have done that had he not been very wealthy. And you know, how much Jesus asked questions of what will a man give in exchange for his soul? What would we give to live longer? And do we need, you know, it's really a philosophical question, but I know the Lord when I die here, I expect to wake in the presence of God. And my mother, when she died, I think she woke in the presence of God. That's my peace with it. But do I mean I want to die right now? No, I'd like to live a few more years, you know. I got things to do. I want to see my grandkids. I might want to see a great grandchild. My oldest my wife doesn't, but I do. My oldest grandchild's married now. Next she's 22, the next one is 21, you know. They're getting the age where Sharon and I got married when she was 18. And I was 21. There's 3.5 years difference between our ages. Sharon had our first child when she was 19, just before she turned 20. That's my daughter Amanda. You know, man, they're 22. Where's my great grandchild anyway? So the last thing I wanted to mention in this: what barriers to health exist locally or globally? Which AAQ principle is most difficult to achieve, and how would government balance limit resources with human rights obligations? You know, when you look at all this, healthcare is a very complex situation. There is no immediate answer. And, you know, they'll make a decision, but what if it's their child? You know, and it can happen like that. If it's my child, what do I do? My daughter, I was making a lot of money when I lived over in the Middle East. My daughter called me one day and said, "Daddy, you know, my granddaughter had an immunity problem." And, you know, like the kid in the bubble type thing. And I told her, I said, "Amanda, what do you need?" She needed some money. I helped her with it because it's my granddaughter. What am I going to do? Let her die with him? And she recovered. Fortunately, it was just a temporary thing. But what if it had not been temporary? When it gets to be your family, it makes a difference. Me, I told Sharon, I said, if I get in bad shape, fly me back to the UAE. I love they had so much better health care there. I'd go to the doctor. I had an 11 o'clock appointment. I saw him at 11 o'clock. 11:30, I was headed home. I'd seen the doctor and my medicine was paid for. So it was a great system. So, but I'm just asking questions. You know what oh, there's all sorts of barriers. We got politics is in the way. I mean, the president and who are fighting each other. What happens if we have another COVID pandemic? Next thing, who knows what it might be? How many people might die? We have to interface as nations. It's just too dangerous not to. We've had worldwide pandemics. In World War One, they had the Spanish flu, killed millions of people worldwide. We've got COVID. Polio. Nowadays, I could be in XYZ and I get a disease. I can get on an airplane and fly to the other side of the world and I can expose the whole world to that disease. That's the world we live in. And that's why, that's what's so hard about handling pandemics. Uh, COVID went wild. Listen, I had relatives that died of COVID. My daughter almost died with it. And she had effects of it for 2 years afterwards. Had long COVID anyway. Anything you want to point out before I let us go? We're almost done. Does it help to have my notes?
Yeah.
Yeah. Makes it easier to follow along.
I'll try to do that for you every class day, okay? I want you to do well. You two guys, y'all are busting it, you're after it, and I'm proud of you, okay? But we're going to make it. You have to forgive the things that are just my opinions. I have some opinions. Whether they're right, I don't know, but they are my opinions. So let me stop the share. Here I am. We're still recording. Let me stop the recording and